Today we're going to be teaching you some new strengthening exercises. As discussed in our intro video, research shows that upper extremity muscle weakness, muscle imbalances, and decreased core strength all contribute to an increased injury risk in wheelchair tennis athletes. We believe that these exercises are great for the overhead wheelchair athlete, not only because they're based on research, but because they were created with the muscular demands and positions of the sport in mind. In addition to providing our primary exercises, we will be providing progressions and regressions to each exercise, as well as modifications for athletes with decreased core control or hand grip function. Our strengthening exercises are broken into 3 groups. The first 2 groups contain 3 exercises, while the third group contains only 1. 3 strengthening exercises in total, 1 from each group, should be completed on a typical warm-up session. The first set of exercises contains motions that primarily strengthen the shoulder external rotators and the posterior deltoid. Please note that while these are the primary movers in the exercise, they are not the only muscles working. Exercises were selected to intentionally target multiple muscles at a time in order to create a more comprehensive warm-up program. Each exercise should be performed at an intensity of 12 to 15 on the RPE scale. If the athlete identifies the intensity of the exercise as being below a 12 on the RPE scale, the exercise should be progressed to something more difficult. Likewise, if the athlete identifies the exercise as above a 15, the exercise should be regressed to meet the appropriate intensity range. Unless otherwise noted, each exercise is done for 2 sets of 8 to 12 repetitions. The first exercise within this set is the posterior chain row complex. This exercise is performed with a TheraBand. The wheelchair will be positioned facing toward the fence with the chair locked or blocked in front of to prevent rolling. There are 2 ways this exercise can be performed. For the first method, the TheraBand is attached at the level of the shoulders. The athlete will start by performing a high row, move into shoulder external rotation, and then perform an overhead press. For this exercise, the athlete should work at a slow pace, focusing on scapular retraction. We also want to avoid excess shoulder elevation or shrugging of the shoulders. Alternatively, the TheraBand can be attached lower at approximately waist level. The athlete will then perform a regular row, move into 90 degrees of shoulder abduction, then 90 degrees of shoulder external rotation, so the arm is now in a 90-90 position, and then perform an overhead press. With an additional step, this second method will be slightly more difficult. This exercise can be modified for athletes with more limited core strength or stability by being performed unilaterally. For athletes with impaired grip function, this exercise can also be performed using an assistive device such as active hands, with a TheraBand with a handle, or with a loop tied at the end of the TheraBand. This exercise can be progressed by adding more resistance. To regress this exercise, you can decrease the amount of resistance or perform components of the exercise in isolation. Unlike the other strengthening exercise, this row complex will only be performed for 5 repetitions. The second exercise within this set is a face pull. Again, the wheelchair is positioned to be facing the attachment of the band. The athlete in this clip is in a sports chair, so we have another person assisting in stabilizing the chair. This athlete has some use of his legs, so he can also help brace himself. The resistance band is anchored so that the shoulders begin at approximately 120 degrees of elevation. The shoulders should pull the band into horizontal abduction and external rotation. At the end of the motion, the thumb should be pointing behind the athlete. This motion should be slow and controlled. By anchoring the band above the head, we increase demand on the lower trapezius, an important mover and stabilizer of the shoulder blade. Common compensations during this exercise include protracting the neck forward, shrugging the shoulders toward the ears, and flaring of the ribs or pushing the chest out. This exercise is primarily progressed and regressed with the weight or strength of the resistance band. The third exercise within this set is a pull-apart series. This exercise has 3 components. First, you'll hold the TheraBand at shoulder level with palms facing down. Pull the band apart as you bring your arms out toward the side. Do this for 10 repetitions. Then, flip your palms so that they are facing upward and do 10 more repetitions. Finally, you'll finish with your elbows at your side and bent to 90 degrees with palms facing up. Keeping the elbow at the side, pull the TheraBand apart. Again, this is done for 10 repetitions. Adjusting how close or far you're holding the band will increase or decrease the resistance, respectively. For an even greater change to the intensity of this exercise, change the color of the band being used to make it easier or harder as appropriate. The second set of exercises focuses primarily on strengthening the scapular retractors, spinal extensors, and abdominal musculature, particularly the internal and external oblique muscles. The first exercise in this set is an overhead W pull-apart. This is a bilateral exercise and requires a TheraBand. The TheraBand should be held by the athlete in both hands. The athlete's arm should be placed in an overhead position, shoulder width apart. The athlete then separates or pulls apart the band and brings it back down towards their side, making a W shape. The athlete should make sure to keep tension on the band throughout the motion and focus on squeezing the shoulder blades together to avoid excessive upper trap activation, as this is not the muscle we're trying to target with this exercise. For athletes with decreased core control, this exercise can be performed unilaterally. The wheelchair should be positioned parallel to the fence and the band will be attached overhead. The athlete will pull the band outwards away from the fence and down towards their side, making a half W shape with their working arm. For athletes with limited grip function, modifications include using an assistive device for grip, using a TheraBand with a handle, or tying a loop at the end of the TheraBand to be put around the palm of the hand or more proximally on the wrist. To progress this exercise, it can be performed at a slower tempo, for more reps, or at an increased resistance. To regress, resistance can be decreased or the exercise can be performed unilaterally. The second exercise in this set is called sword pulls and is a combination of shoulder flexion and thoracic spine rotation. This exercise is performed in a locked wheelchair. This is a unilateral exercise that should be performed on both sides. Beginning with the right arm, you will place both hands on the band just in front of the left hip. The left arm is going to remain in place to anchor the band. The right arm will then pull the band to move the arm up and back. As the shoulder flexes, the trunk should open up and rotate towards the right side. The head and neck should remain neutral, following the trunk. Throughout this motion, the thumb should be pointed up as to put the shoulder in a slightly externally rotated position. We do not want the thumb pointing down, as that will limit the range of motion and potentially impinge the shoulder. The preceding direction should be reversed when the exercise is performed on the left side. This exercise will most often be progressed and regressed based on the weight of the TheraBand. The third exercise in this set is a row with thoracic spine rotation. To set up this exercise, make sure the wheelchair is facing forward and locked. A band should be attached at or slightly below the level of the shoulder. The wheelchair should be positioned far enough away to have adequate tension in the band. This exercise will be performed unilaterally. The athlete will perform a row with simultaneous rotation toward that same side. The athlete should focus on squeezing the shoulder blade down and back. Also make sure to keep the shoulder from shrugging towards the ear to avoid overusing the upper trap to complete the exercise. This is a common compensation and may appear when the patient is fatigued. To progress this, resistance can be increased by using a stronger band or placing the wheelchair further away from the band attachment. To regress, resistance can be reduced by using a lighter band or placing the wheelchair closer to the attachment point. It can also be broken down into two components, by first performing a row and then adding in rotation.
The next set of exercises consists of only one exercise. The focus of this exercise is on core strength and stability. The trunk plays an important role in controlling the wheelchair during sport play, as well as transmitting and absorbing forces that are traveling through the shoulder complex. The exercise we have chosen for this set is the pallof press. To set up this exercise, the wheelchair will be facing forward and will be locked, or if in a sports chair, blocked from moving. A band is attached at or just below shoulder level to the side of the athlete. The pallof press is performed by grabbing the band with both hands and pulling the band to the center of the chest. While keeping the band in line with the chest, extend your shoulder and elbows out in front of you. The band is pulling the arms and trunk towards its attachment, and the goal of the exercise is to resist the rotation and maintain facing forward while keeping the arms at midline. Similar to previous exercises, this exercise can be made more or less difficult by changing how close to the attachment you're holding the band, or by changing the color of the band. Additionally, this exercise can be progressed by incorporating a rotation away from the anchor point or by drawing circles or the ABCs while in the pressed position.